Hello, my name is Richa Gupta, and I'll be presenting our project titled Telehealth Perceptions Among US Immigrant Patients, a cross-sectional study within an academic internal medicine practice. While the use of telehealth has increased dramatically in the pandemic, little is known specifically about the immigrant experience. Previous research has shown that naturalized citizens and non-citizens are less likely to use e-health services, and that immigrant patients are often concerned about communication due to cultural and language barriers. We aim to understand if concerns about communication were exacerbated in a telemedicine setting and to identify the reasons behind immigrant visit preferences. 270 patients were queried between February and April 2021 utilizing an adaptation of a previously validated patient satisfaction survey. In-person visits were given a paper copy of the survey at their visit, and telemedicine visits were followed up with a phone call to administer the survey. The survey was available in English, Spanish, or Arabic, and patients were surveyed in their preferred language by a certified translator. The survey consisted of 9 questions on a Likert scale scored from 1 to 5, assessing satisfaction under categories listed on the left. An additional write-in question assessed reasons for next visit type preference. Results show that satisfaction with perceived quality of care was universally high regardless of visit type across both patient groups, and that majority of patients preferred next visits to be current visit types. Our most significant finding was that immigrant patients felt providers spent more time with them during televisits, whereas non-immigrant patients felt that providers spent more time with them during in-person visits. As expected from previous research, non-immigrant patients prioritize convenience when choosing telemedicine visits, but in our study, immigrant patients prioritize time with provider as their reasoning behind choosing telemedicine visits. In conclusion, our data shows that immigrant patients have higher satisfaction ratings for interpersonal communication for telemedicine visits, and qualitative data shows that this may be due to not having to navigate additional office barriers present during in-person visits. Future directions include working on eliminating these barriers to ensure a more equitable experience for patients.